Okay. So basically, what I have discussed till now, that the speaking part of your exam, we have first is the warm-up session. We have general interview-related question. It may last for maybe 5 minutes maximum, or depends on the interlocutor. There is no marks for this part. The purpose of this part is to make you comfortable with the environment, and so that you can understand and accent. The interlocutor, just he is your, you can say, he is just the patient actor. He'll be acting. No grading for this part. This part just have to make you comfortable with the scenario so that you can, like perform well in the next part. The next part is the role play. You will be getting two cards. Both will be profession specific, and you have to play your role as a doctor or as a nurse or as a pharmacist, whatever your profession is. If you're a doctor, you just have to play a doctor role. If you're a nurse, you'll get the nursing role, and so on. Anyhow, so first of all, 2 to 3 minutes time for preparation and 5 to 6 minute time for counseling. You can ask any question in this 2 to 3 minutes time, clarify any doubts, let's say, make the notes, let's say in this time. In counseling time, the 5 to 6 minutes, you can read the card again, you can see the card again. Okay, it's not important for you to make an eye contact, you can see the card time and again. So the card has three things. The first one is setting, that is your clinic, maybe your emergency department, your ward, and so on. Then we have the history component. Doctor already know this thing, or it's in the file. This is more appropriate. It's in the file. Then we have task. So three components: task, setting, history, and task that you can see in the card. We'll discuss in detail. So the first of all, our criteria, we have clinical and we have linguistic skills, on the basis of which you will be marked. So let's start with the first criteria, that is your clinical side. So the first one is your relationship building skill. So the first thing that the examiner would see, that you would be able to start the card appropriately or not. Or simple word, how you have greeted, what is like greeted a patient, right? The first of all, like there are two things in there: the tone and the language. It should be appropriate. Let's say if you are coming for first time versus second time, let's say good news versus bad news, normal versus emergency. So basically, these are some of the things that you can have to show in your reading part. Sometimes you have to pick the cue when you are starting the card. So something that you do have an ability to start the card appropriately, and your job is to start the card yourself. You should not wait for the patient that he or she has to start. So the first skill is your relationship building skills, right? Then we have the active listening skills. Active listening skills mean the patient may dip, let's say, like speak like that. So would you be able to catch those dip or not? So how we can show? Recap what the patient said, like right after the landing complaint. You have to show your active listening skills, right? Just recapitulate 1 or 2, 3 words, specifically picking those words and the patient show the right? Like if this is a graph of the speaking of the patient, so you must not miss the because we could have the potential information in this part. Anyhow, then you should listen to the person without before giving your opinion. You have to be non-judgmental. This is also the part of your relationship building skills, and you have to show empathy. Be in the patient, right? This is the first criteria. I will explain it in again detail as well. The second one is your patient perspective. Let's say, have you explored the patient concern or not? Number one. Number two is we can say relate your patient explanation with respect to patient response, right? This is something like important. You have to explore the patient perspective, or then we have the we can say uh, information separate gathering. What we have to have in the information gathering is to start the open-ended question. I will explain this thing again when I will be telling you about how to do the first card. So right now I'll be just concisely explaining you. First of all, you have to ask the question or the open-ended question. If the patient is responsive, go for close-ended question. We can say these are the collection of question. Starting the open-ended question, close-ended question, and no compounding, no compound question while asking the compound close question. Number one, it's important for you to understand. Okay, they should be open and closed. It should not be the closed and open. We have to see that. Do not interrupt while gathering the information while the patient is speaking. Right? Do not interrupt the patient while he is speaking. Okay. And if there is any vague information, clarify it while gathering the information. Okay. And you have to summarize the information when it's needed. Okay. Afterward, like when you are providing the information, what you can do is beforehand, you must know what patient know. Before you can start providing the information, what patient know. Okay. Then when you start providing the information, you need to sequence with the help of cohesive devices, signposters. Signposters changes like transitions, and with the help of it should be organized. Listen, you must have natural pauses while explaining it, and also encourage the patient to participate. Right? So these are few areas that you must. Let's start with how would you do the card if you are seeing the patient for first time not an emergency, okay, just a normal encounter, but this is your first time you are seeing the patient. So again, with reference to the marking criteria, we start with the greetings part. Like if you have greeted the patient appropriately or not. So we can start the card with hello, good morning, good afternoon, and so on. Then you can see the energy of these words, like in simple word, if there is high tone or slow tone, depend upon the situation. Hello, Mr. Mark. Good morning, Mr. Mark. Like that. Good afternoon, Mr. Mark, or good afternoon, like with low tone, depend upon the scenario. Anyhow, once you start the card with greeting, you can ask the patient like how you have been, let's say, or good afternoon, Mr. Mark. Please have a seat. Nice shirt. So after greeting, after you greeted the patient, right? You have to settle the patient down. If your card allows, go for the rapport building skills. Rapport builders are icebreakers. Anything? Let's say nice shirt. For example, what a wonderful weather today. Discuss about any sports events, but try not to have the conflict. And God forbid if you have conflict, try to cover this thing up, right? The company call. Anyhow, the first step will be the greeting. You start that. Hello, my name is Doctor Blah and Blah. I'm a doctor in this medical practice or in this suburban clinic. Please have a seat. Nice shirt. You are wearing a wonderful shirt, a beautiful shirt, and so on. What a wonderful weather today. Like that, right? Afterward, you can start with the open-ended question. So we have two format to for the open-ended question. Simply, how can I help you? What bring you over here? What seems the problem? Or mostly we have to use this line. I just have gone through your file and I came to know that you have let's say headache for 3 months. But can you explain me in your own words? So you can start. This is also an open-ended question. You can start the card with this question. It's better. Seeing the patient for first time because you have multiple things written in the history part. It is also a source of confusion for the candidate. They always ask the fact that should we start with the task or should we start with the history part because we already know this thing is written that the patient has given this information. So why should we repeat? So to answer this question or to make a balance because inquiry or information gathering skills is an important part of your counseling and as well as your marking criteria. So what we can see that it is important for you to start with the this question. I just have gone through a file after reading and after setting the patient down actually, and if there is no queue, we can start with this card. I have just gone through your file and I came to know that you have headache for the last 3 months, for the last 3 weeks, whatever. But can you tell me in your own words? Now, this is an open-ended question. This will give you an idea that whether the patient is talkative or if he is reluctant. Let's say if patient is talkative, we'll directly jump after showing empathy. We'll go to the closed-ended question. Empathy has to be shown whenever you if the patient explain you like the full letter complaint. However, if the patient is reluctant, let's say he just asks you, I'm having headaches, the same word that you just mentioned. So ask for another open-ended question. Ask for another open-ended question. So knowing this part, like starting the conversation with this part, how can I help you? What bring you over here? Or the most important thing, I have gone through your file and I came to know that you are having headache for the last 3 months. But can you tell me your own words? What seems the problem, right? So this is your basically an open-ended question. The response to this question will tell you if the patient is talkative, if the patient is reluctant. Now, if we have a talkative patient, let's say if we have a talkative patient, so we can go for the closed-ended question. I'll explain you in a while. But if we have a reluctant patient, we'll ask another open-ended question. Like, can you tell me a bit more about your problem, a bit more about your symptoms? If you don't mind, if you can just explain me in detail like that. So asking another open question, then showing empathy. Now people always ask that what are the statements for empathy, right? Always a source of confusion. What I would suggest them, use the presenting complaint as the statement of empathy because empathy is more of tone and the body gestures that is not being, gauged in your OET speaking over here. So we have to take the tool of your, we can say tone or intonation. Oh, Mahar, it's totally understandable that you have been in a distressful headache for the last 3 months, right? So using the same word, just the tone, showing what we can do while showing the empathy with the help of tone, adjustable. It should, it might be makeup right now at the moment if you don't have the empathy in your tone, but you have to learn, to adjust the empathy according to the scenario. After showing some empathy, you need to, like show the active listening in parallel. Like just I mentioned, oh Mark, it's not understandable that you are having a headache for the last 3 months. It must be distressful for you, right? Like active listening and empathy in parallel. So after showing the empathy and active listening, you need to go for the closed-ended question. So what are the closed-ended question where you can have the answer mostly in yes and no, right? So we can say these are the collection of question. So what do you mean by the collection of question? Or the group of questions that are disease specific or the problem specific, whatever the problem is. You can use the range of grammar over here. It's easy. For example, how long you have been having tense, a type of sentence. Okay, is there any family history tense? Have you consulted, let's say, or when, what, let's say, you have been having headache for 3 months, statement based question. So these are the range of questions. Mostly, you can say that 2 to 3 questions, not more than that. You have to ask. That question should be specific. The question should be specific, actually. So after asking the open and closed-ended question, like in the card when you are seeing the first encounter, you can go with the, you can say, if your card allows you to go for the examination after inquiring, go for the examination. We can be empathetic while examining the patient. Use some statements such as, like, please lie down the couch, take off your shirt. I'm going to press your belly, let's say. I'll try to be gentle. If you feel any pain, please raise your hand, right? But if your card allows you, you have to go for the examination, right? It's something that you have not to perform, but to speak. It's not necessary to go for the complete examination. You have to show the skills only, the skill of yours. Okay. So after examination, if it's something like say we have a diagnosis, you have to ask the patient, what do you think? Patient concern, expectation. Because now we have gathered the information, right? Now we are going to provide information. So what do you think? What it could be? Like exploring the patient expectation. Exploring the patient expectation, right? You have to explore the patient expectation first of all. So let's say whatever the patient told you. If the patient tell you that I believe that it's a cancer, first of all, assure even it's not in your card. Let's say assure the patient that it's not cancer. So then you have to move on. Let's say if it's migraine with the headache card, right? Then ask the patient, what do you know about migraine? Politely. Or do you mind if I can ask you what is your understanding about the migraine? Or have you ever heard this term before? Any of the question you can ask from the patient so that you get to know where he's standing with reference to the patient knowledge of migraine, right? Then explain in layman. Remember that, let's say, if you can see that if the patient is reluctant in the card, in the task, you would have an idea if the patient challenges your diagnosis or if the patient is reluctant from the treatment that you are suggesting. So, in this part of time, while explaining, you must make your ground. Like, say, whatever the patient concern is, if the patient do not want to take the medicine or if the patient does not accept your diagnosis, it's written in your card already that the patient challenges your diagnosis in the history part. So you have to prepare your card accordingly. And you need to tell the patient that if this is not gonna handle in this way, I believe that the symptom may worse and so on, like that. Okay. You have to explain in layman language, but while explaining, make your ground up, right? Okay. So basically, explain in the layman language, right? It's better to explain in the layman language. Okay. After exploring explaining this part, like wherever the patient is standing, like educating the part is to ask the patient if he or she understood what you explained, right? Or if there is any other question after diagnosis, or if there is no any other question, you can tell the patient, I would like to move on toward the treatment. Now, this is called as signposting. These three steps are the signposting mean from the diagnosis toward the treatment, you show the transition. There must be signposted between each major task, not between each task, but between each major task. Let's say diagnosis, treatment, prevention. These are the major tasks. After you can say explaining the patient, you have to you can say ask the patient like if he's having another question or not. After signposting, you can move on to the next task. Let's say even in the treatment or the prevention, it's in the education part, must take the natural pauses, right? It is important for you to understand that you must take the natural pauses, right? And use the cohesive devices. Let's say furthermore, let's say moreover, let's say first of all, secondly, and so on. So when you finish your task, you will see the task. Let's say these are your tasks. When you finish your task, after last task, ask the patient. It's compulsory that if he or she has any other question, right? It's very important for you to understand that you need to ask the patient if he or she has another question, right? Then summarize at the end. Encourage the patient to contribute. Let's say if you have a talkative patient, uh, you ask the patient, let's say I've seen your file. I came to know that you are having headache. Can you tell me onwards? If I would be talking to a patient, I'll speak at it. Yeah, doctor, it's quite severe. Like I cannot concentrate my work. Light sometimes are it's quite penetrating for me. I cannot drive properly. It's followed by nausea and vomiting, doctor. I cannot. Oh my gosh, I cannot sleep properly. Now you can see the patient had given you a lot of information in this card. So empathy. Oh, come on. It's totally understandable that it's a distressful thing for you. You cannot sleep properly. The lights are the triggering factor for you for this headache, right? And like you mentioned that you having nausea and vomiting at the same time. So active listening followed by the you can say more 2 to 3 questions. So is there any other thing that you have noticed, or I would like to ask some personal question if you don't mind? Can I? So you do smoke, or what about your alcohol intake? If it's written in the history part. So do ask 2 to 3 more questions, then move on. In case if your patient was talkative. But if your patient was reluctant, let's say, then you can ask another open-ended question. Can you tell me a bit more about your problem? What is the example of a reluctant patient? You can ask the patient, "Hello, Mark. If I have seen your file, I came to know that you are having headache for the last 3 months. Can you tell me in your own words? Yeah, doctor, it's quite severe headache I'm having. Khalas, that's it. So then the patient will ask you, Mr. Sorry, the doctor has to ask you, Mark, it's totally relatable that you are having headache, but can you tell me in more in detail so that I can better understand your condition? Another open-ended question. Maybe 1 or 2 questions might be needed in this case, right? So let's say if you can receive this type of call, this is the recall from the setting. This is setting, let's say suburban clinic, right? Now this is the history that you already know, and this is the task, 3 tasks that has to be achieved. So you will be given 2 to 3 minutes time to prepare the notes. Most importantly, remember that we always have most of the time presenting complaint in this part of the history. This is the background information. Still, you need to read it full because initially patients doctor starts counseling after reading this line and start focusing on these things because this is not the presenting complaint. This is the background information. We have the presenting complaint in this part anyhow. So now we can read it. You are speaking to a son or daughter, so we have a carer. We can confirm the name. Okay, most important thing is candidates are always concerned that how should we start the conversation? What should we call him? So to answer this question, in all scenario, either it's a first encounter or second encounter, in the warm-up session, let's say, in the warm-up session, you can confirm, or if not, then in the preparation time, you can confirm that how should I call you, right? To from the person. So you can see here you are speaking to a son or daughter of your patient, Harry Smith. He's your old patient who has a history of, we can use irregular heartbeat rather than using our atrial fibrillation. In this conversation, you should not be using the medical term. And he's on the warfarin, okay, to reduce the risk of thrombosis and whatever. We can say abnormal formation of migration of blood clots, already done in the layman language. Now, this is a presenting complaint, Paradin 4, because patient had a fall and he has extensive bruising, otherwise he's well. So he is here, and you have to refuse the patient, but do not refuse judgmentally, like before listening to the patient. So how can we start this conversation? You can start in this way. Hello, my name is, let's say, Dr. Blah and blah. I'm one of the doctor in this clinic. If I'm not wrong, you are Mark, son of Harry Smith, right? Like that. Okay, Mark, I can see from your file that your father had a fall, but can you tell me in your own words, like how he had fallen and what seems the problem? Then the patient will tell you, yeah, doctor, actually he had a fall and I'm quite concerned about his pain. He cannot walk properly, he is in pain to the point that he cannot come to the clinic. You have to show empathy, show the active listening skills, then move on. So after showing, oh, Mark, it's totally relatable that we cannot see your father in pain as he had a fall 2 days back, right? So Mark, have you consulted any doctor? Now we are moving on toward the close end question. Okay. So you have not consulted a doctor, what you're saying. Fine. So is there any history of bruising? We already know, but I'm asking. Okay, fine. So you mentioned that you have not consulted a doctor just by the advice of your sister. You had given this Paradin Fort, right? If you don't mind, can I ask you, is your sister a healthcare professional? Oh, okay. So she's not even healthcare professional. So Mark, is it possible for you if you could bring Harry in here? Because I'm afraid I need to see him first before writing any prescription. This is also a refusal. I refuse the patient now because I'm afraid I need to see him first rather than saying that I cannot give the medicine. Then the patient will give you tough time. Well, I don't understand that he's in pain. Why are you not giving this medicine? You need to, okay, Mark, as you can see, I can see the file of your father. He's having irregular heartbeat, and in order to maintain them, he's taking a medicine called warfarin. Okay, so a group of medicine called warfarin and a group of medicine called Paranil food cannot be given in parallel because they could uh, have a negative effect if they can be given in parallel. Okay, basically, like the warfarin that your father has been taking for your heart condition, this medicine, Paranil food, cannot be given, and it's important for me to assess your father first before we can decide what medicine has to be given. Okay, but let us show you. I can find a way for you. What about if I can visit your father at home? What do you think about that? Then the patient will give you tough time that it's not needed. I need to. I cannot convince my father to be there. Then you can offer him a home visit after Harry's consent. Okay, so this is the way you can do this card. Any question that you want to ask in this card?